Hi there, and welcome back to our coping skills class. I'm your host, Tom DeBray, and thank you for being here today. So today we're going to be talking about anxiety, panic, and depression, and what does that actually look like? So the goal of this isn't to diagnose yourself, but it is to try and familiarize yourself with some of the symptoms that you might be experiencing, and that others are experiencing those as well. So with anxiety, there's apprehensivness, nervousness, and it's usually about an impending or anticipated uh, fear or ill. So what you might be that most anxiety is future oriented, and so that you're anticipating that something bad is going to happen. It hasn't yet, and that's what the anxiety will be. So that'll be a lot of your heart might race, your thoughts might race, you might start to sweat, you might start to really worry over and over and over about a certain thing that may happen, or you might think of multiple scenarios of how that might occur, and that's a big part of anxiety. Now, to go a little bit more intense would be panic, and this would actually be a fear response. Now, panic in and of itself, if it was a panic attack or a panic disorder, it's in the absence of a fearful event. So if you were out in the woods and all of a sudden there's a pack of wolves and and your heart rate's racing, which it should. Um, that is a fear response to a legitimate threat. And so what panic is you might be actually just shopping at the grocery store, and you start to experience the same as if you were with that pack of wolves. So it'd be really increased heart rate. You're going to be, which it can be very high. An adult's heart rate is usually 70 to 90 beats per minute. Panic attacks can actually go up to about 200 beats per minute. And so this is a real threat response to the body, or at least it's a perceived threat response in the body that is really trying to get your body filled with a lot of the stress chemicals and adrenaline, and to get you prepared for fight or flight. So panic is a very, very hard thing to deal with. Good thing is most panic attacks last 5 to 10 minutes. Some can be up to about 20, but it will subside. And so the skills that we're going to teach you in this class will help you to actually lessen some of the panic attack symptoms, and hopefully down the road to alleviate the panic attacks um, completely. So definitely stay tuned for the other classes. Now, depression uh, can be mild to severe. It can be very debilitating for people. People, often will describe it as, I want to get out of bed and it's like 1,000 pounds is on my chest, and I can't get up, and I don't care if I get up. And so the good thing is this class will be good for low to moderate low mood or depression, and that those symptoms can change. And even if you have major depression, these can help, but you may need greater interventions. So some of the symptoms that you would be experience with depression would be feelings of sadness, apathy. You may not enjoy things that you used to. Food may not have any sensation or enjoyment. You might eat too much, or you might not be hungry at all. You might sleep too much, or you might not sleep at all. There's often a lot of feelings of guilt or unworthiness. And some of the everyday decisions that you would make would just feel like it's an impossible task. On the extreme end of depression, we would have thoughts of suicide. If you are experiencing thoughts of suicide at this point, we will be putting some links into for some 1-800 numbers, because those are, when you're thinking in those terms, that's a little beyond what these classes are going to be able to offer, and that you probably need some help more immediately. So look to the links below, and we'll have some of the provincial numbers and a national number for for Canada. If you're in a different country, then I would encourage you to look up those numbers in your own area. So with that, that'll be it for our class for today. Thank you for checking in. The next class that we're going to be talking about is going through our nervous system. I know that probably sounds not that interesting for you, but it will explain some of the rationale of why we're going to be teaching some of the skills that we're going to be teaching. So I would encourage you to stay tuned, and I'll see you in the next class.